Good afternoon, everyone, and thank you for joining us this afternoon in HIV 101, our last webinar series for the Caddyshack Project in 2021. I'd like to formally begin today's session by acknowledging the traditional custodians of the land upon which we all meet across New South Wales this afternoon. I'm here in beautiful Yuin country on the south coast of New South Wales, land of the Wadi Wadi and Wandandian people. As we share our learnings here in this space this afternoon, may we also recognise and share the learnings of our traditional custodians. We would like to pay our respects to elders past, present and emerging, and welcome all Aboriginal and Torres Strait Islander colleagues present with us online this afternoon. So, as I said, thank you for joining us for HIV 101. As we approach World AIDS Day on the 1st of December, I think it's a really important time for us to take this time out to enhance our skills and knowledge around HIV, but also a really nice time for reflection. And in talking about reflection, I would also like to acknowledge that today is Remembrance Day, and we remember all of those who have fought for this great land that we stand on today. I'd like to begin this afternoon's session by sharing a blog that I had written in September last year. We did share this as a part of this same webinar last year. Who knew what 2021 would hold, and that in some ways it would be very much the same as 2020. And we feel that this blog is still particularly relevant to today, and that it's a great way to introduce our conversation for this afternoon. So I'm going to take a moment to read this blog before introducing our great guest speaker for this afternoon. So the experience of COVID-19 has been an interesting moment of reflection for some, but viruses are not new to us in the world of sexual health, along with witnessing discrimination and stigma and holding on to dreams of vaccinations and cures. What is new to most of us, though, are the death stare glances that you get when you sneeze or cough, glances that suggest that you could be risking the lives of others. Memories of the plague come bouncing back, and the lyrics to the song Ring a Ring a Rosie come to mind. A tissue, we all fall down. For weeks, tuning into the media became difficult as news of deaths across the globe from this pandemic took a hold. We saw scenes of mass grave sites in New York City, which took us back to the 80s at a time where AIDS was taking the lives of thousands of young men, and similar scenes unfolded. With all the change in the world, are things much the same? Perhaps HIV has taught us resilience. It's opened our minds to acceptance, helped us to eventually get back to meaningful lives and events, i.e. sex, without fear, taught us how to use protection, and allowed us to understand measures against viral infection. Maybe, just maybe, we somewhat know now how it feels to live with a virus, what it feels like to be ostracised, to be looked down upon, and to live with the uncertainty of health and feel the real possibility of death. Our HIV warriors faced all of this and continue to fight this fight every single day. Nearly 40 years into this HIV journey, there is still no vaccine, still no cure. Yet scientists came up with a vaccine for COVID-19 within 12 months. Dust off those passports, people. It's nearly time to use them again. What a wonderful world it would be if we took this time to graciously reflect on the journey of our HIV warriors so far. That, instead of being quick to judge and to pass opinion, stigmatise and discriminate, we took the time to listen to their story. We each have a chance to be positive, a positive part and a happy part of somebody's journey. What if we choose empathy over assumption? Can you challenge yourself, maybe just to try? Because now we all realise what it's like to be vulnerable to a virus. Viruses have no power to discriminate, so why should we as people discriminate? In the words of the late Lady Diana, Princess of Wales, HIV does not make people dangerous to know, so you can shake their hand and you can give them a hug. Heaven knows that they need it. If only she had the foresight to see what would have unfolded in 2020 and 2021. I would now like to introduce our guest presenter and speaker for today. Josef Garrington is the Community Health Promotion Officer for Regional Communities, working with ACON New South Wales, outreaching to Illawarra and Southern New South Wales. It's no secret that Josef is one of our biggest fans. and we are certainly one of his. We admire his enthusiasm, his passion and commitment to both gender and sexuality diverse people here in our region. So without further ado, I'd like to hand over to Josef and allow him to welcome everyone today and to say a little bit more about himself. Thank you, Josef.
Oh, thank you, Naomi. It's great to be here. They were beautiful words that you just read then, and yeah, really impactful, I think. And yes, thank you so much for your ongoing support with ACONs. So for those of you who don't know what ACON is, we're a New South Wales health organisation for people of diverse sexualities and genders and people living with HIV. And the bulk of our funding comes from the Ministry of Health, New South Wales. And most of our funding is for HIV prevention and support work. I, of course, do a whole lot of other stuff as well that impact our communities. And as you mentioned, I am a regional outreach officer for the South Coast. So that includes Wollongong all the way down to Bega. I'd like to acknowledge that I'm coming to you from Gadigal country as part of the Eora Nation. So I'm based in Sydney. And I pay my respects to all of the Aboriginal elders, past, present, and emerging across all the lands that we're all streaming in from today. And I extend that to any Aboriginal and Torres Strait Islander people who are with us as well. Yeah, thanks. Great to be here. And let's get into the chat, hey?
Great. Thanks, Josef. Excellent. So I'd really like to obviously start at the very beginning. It seems like the most obvious place to start. And while some people joining us today may have some knowledge about HIV, we're going to assume that this is very much an introductory course, as the 101 states. So Josef, would you like to kick us off this afternoon by letting us know what HIV actually is and what HIV stands for?
Yeah, sure. So HIV is human immunodeficiency virus. And it is a virus that weakens the immune system, which makes someone's body more susceptible to infection and disease. So their immune system isn't able to fight off those infections and some cancers as well as it would if it didn't have HIV. So that's what the acronym is. A lot of people don't know what the acronym actually stands for.
Yeah, and it is a little bit of a tongue twister to get your tongue around that. And I guess when we talk to people about STIs and what STIs or bloodborne viruses they're aware of, HIV does come up, but something else comes up more often than not, which is AIDS. So can you explain AIDS to us a little bit more and how AIDS is same but different to HIV?
Yeah, sure. So AIDS stands for acquired immune deficiency syndrome. So that is diagnosed, well, a person has AIDS when the HIV virus has, impacted their immune system so much that the person then has an illness. So it could be an infection or a type of cancer, and that is actually killing them at that point. So that's what AIDS is. So if someone is living with HIV, they don't have AIDS. It has to get to a point where the virus is so heavy in their body and their immune system is so weak that they get an infection, and that's when they have AIDS. So yeah, there is a lot of confusion about the two. Thankfully, within Australia, not many people get to the point where they have AIDS, and that is due to our really good health system that we have. Testing usually picks up HIV before it gets to that point where someone is actually really ill. That's not to say that it doesn't happen. It still does, but not as what it did back in the 80s and 90s that, most people probably think of when they hear AIDS.
Wonderful, thank you. So it's important for us to know that AIDS still does exist, and I suppose over in some of those developing countries where, like you say, they don't have the same access to healthcare and the medications that we're fortunate enough to have here in Australia. So it is something to be mindful of. And is it true that somebody could be diagnosed with AIDS but start medication and actually revert back to just HIV status?
Yeah, so there is treatment now that if someone is really sick and they, get onto that treatment and it's working well for them, then the virus will be suppressed and they'll be a healthy person again, which is really good.
It's just so exciting, isn't it? I mean, to think about how far we've come, and I know that you'll allude more to treatment as this conversation goes on, but just how far we've come in that 40 years in terms of treatment, and now what we're able to do with people with HIV, it's just amazing. I think it's also important to highlight the people who we commonly see with HIV in Australia. I know that you're going to touch on this a little bit in a moment, but whenever we've done the healthcare workers quiz around HIV, people automatically assume that HIV only affects men who have sex with men. But I'm really interested to find out that globally, who's most affected by HIV?
Yeah, it can be women and children due to childbirth and breast milk. So yeah, that is a bit of a surprise for some people.
Excellent. Something for us all to keep in mind as well, and think about the client groups who we're working with and the potential risk factors that they may have, and not just make assumptions about who it is that the HIV virus impacts, because it can impact on anybody. So we might jump on to our next question, Joseph, which is, how does one get HIV? There's obviously a virus that exists, but we need to have it transmitted from one person to another. Are you able to explain those transmission methods or avenues a little bit more for us, please?
Yeah, sure. So HIV can be transmitted via 6 bodily fluids. And saliva is not one of them. That is often, something that people always say when we ask the question, name the 6 bodily fluids that can transmit HIV, and nearly every time someone says saliva. So they are blood, of course, because it is a blood-borne virus. Semen, pre-cum, so the pre-cum that comes out before ejaculation, vaginal or front hole fluids, anal or rectal fluids, and I already mentioned it, breast milk. So breast milk, that doesn't happen in Australia, mainly because pregnant women in Australia, they get into our health system, tests are done, they are tested for HIV. So that method of transmission doesn't happen in Australia. In other countries, it still does, and that's due to their health systems and access to health. So they're the 6 bodily fluids that can transmit it. It's important to know that the HIV virus is quite a weak virus, so it has to be direct contact, like direct, blood to blood contact. So if someone had HIV and they had cut themselves and there was some blood on the table, the HIV within that blood would die pretty quick when it is exposed to oxygen. It has to be very direct contact. So that's, for example, if someone is sharing and injecting needles, if they're injecting drugs, or it can be through unsafe sex. So that's when semen or vaginal fluid goes from one person to another, and through, say, a tear or a sore within the other person, and that's the entry point. It's also important to know that there needs to be enough of the virus in the person to be able to transmit it to another person. And we'll touch on what undetectable viral load means a bit later on, but a person needs to have enough of the virus in them to actually give it to someone else. Yeah, so I hope that sort of clarifies some of those, unknowns about how transmission occurs?
It does. Thanks so much, Joseph. And I think you highlight a really good point there in terms of the virus being quite a weak virus. I think that, the media has a lot to answer for in terms of almost like a fear mongering around HIV. And, there's this virus out there and it's so contagious and really it's not. I know that, say, for example, with community sharps injury, if somebody had gone for a walk along the beach or they were playing at a park and there was a community sharps injury, that the panic automatically was, oh, I might have got HIV, when in fact there's very little to no chance that that's the case. Hepatitis B and C potentially, but HIV, like you said, as soon as it exits the body and is exposed to heat, sunlight, oxygen, it's just not hardy at all and it dies off. So now that we know what it is and how it's transmitted, are you able to talk to us a little bit more about who may be at risk of HIV and the reasons why they may have like an increased risk factor, or what is it about their demographics or their lifestyle that might put them at risk of contracting HIV or having HIV?
Yep, that's a good question. So and I'm talking about an Australian context here. So the bulk of the population that gets HIV within Australia are men who have sex with other men. That has been the case ever since HIV first entered into Australia in the 1980s. So yeah, men who have sex with men have carried, I guess, the load of being impacted by HIV, and that is mainly the case in most developed countries. In sort of less developed countries, the mix is a little different, and that's due to access to health systems and services and contraception use. So there's a few different things globally, but yeah, here in Australia, men who have sex with men are the bulk. But other people who are at risk are people who share injecting drug equipment, people who have had tattoos or piercings overseas, and it might have been an unsterile equipment used for those tattoos or piercings. People who have had sex with people from or who travel to countries with high HIV prevalence, and also people who have sex with a person with a high risk of HIV, such as those I've already mentioned. So they're the main people at risk of contracting HIV within Australia.
Excellent. And just for those who may not be aware with us online this afternoon, are you able to explain why we use the term men who have sex with men instead of just saying gay identifying men?
Yeah, sure. So men who have sex with men is a term used for any guy who has sex with another guy. And that includes gay, bi, other sexuality men who have sex with men, but also people who identify as straight, but they still have sex with other guys. So we use MSM as a term to include everyone within that group.
Excellent, thank you. And just when you mentioned some of those high risk countries, is there a few just off the top of your head that you can think of just to let people know of?
Yeah, so you're looking at some countries within sub-Saharan Africa and some Southeast Asian countries as well. Yeah.
Excellent. And I know that, as you said, the tattooing and piercing in those countries have been a greater concern in the last, not the last 2 years with no travel, but, in more recent years. For that reason, a lot of young people in particular were taking their schoolies trips over to some of those Southeast Asian countries and getting full arm or leg tattoos done because it was so much cheaper than here in Australia. And we've had reports of them coming back with those bloodborne viruses, either hepatitis C, B or HIV. So definitely something that we need to keep in mind. And again, when we're working with our clients and we're thinking about the potential risks that they may have for HIV, thinking really about that history and what the potential for exposure has been. And so are you able to shed a little bit of light, like following on from who's at risk, how are we looking like in Australia, in New South Wales? Are you able to shed some light on the numbers of HIV at the moment?
Yeah, sure. I'll refer to my notes because I've got some numbers here for you. So for the last 5 years, rates of HIV infection in New South Wales has declined by 19%, which is really good news. And that has a lot to do with a lot of the programs that the Ministry of Health have implemented, and ACON has been involved in a lot of those, a lot of the way. In terms of numbers per year, it has consistently been below 300 people per year. That's within New South Wales since 2018, and it continues to go down every year. Last year in 2020, there were 207 new diagnoses of HIV, and that's down from 281 in 2019. Wow. However, it's important to note that perhaps COVID impacted rates, mainly because sex, was less, because there was less casual sex with, things being closed and the health orders to stay at home, but also testing was down. And mainly that's because, some services were directed to COVID testing, but also because people were having less sex, they didn't need to be tested as often. So yeah, there's a bit of impact from COVID about the numbers there. So as we sort of come out of COVID, it will be interesting to see what happens with the numbers again. That might look different in the future. But we've been below 300 since 2018, and it looks like it's going to stay well below that per year if we keep doing the work that we're doing.
And it's such great figures to hear that it's been consistently below 300. And I think that, ACON really need to tip their hat and acknowledge a lot of the promotional work that's been done behind this and a lot of their campaigning. And, big hats off to the community, because they are coming forward for testing and also getting onto treatment upon diagnosis instead of waiting for years to begin treatment like we'd seen in the past, and therefore becoming, less, likely to pass it on to partners at that stage. So it's really heartwarming news to hear that those numbers are being reduced at such a large rate too. So I guess just moving on in terms of exploring how somebody might know that they have actually contracted HIV. We don't always know what our risk factors are, if we've potentially been exposed or not. So how would somebody actually know if they had HIV or if they'd contracted HIV?
Yeah, that's a good one. Well, the best answer for that is for them to get a test. That's the only way you have it or not. But there can be some signs and symptoms that might make people think that something's going on. So it can be like fever. Someone could get a rash. They could have sort of flu-like symptoms. There's a few things like that. And then, of course, they could also be anything else. So that's why it's really important to, if you're feeling different, talk to your doctor or go to a sexual health clinic and talk to a nurse and get a test, because that is the only way that someone will know if they've got HIV.
And it's a great message, Joseph, in that sense that if you feel that something isn't your normal or it feels different to you, that it is really important for us to go and seek medical help and advice, and not just assume that because those symptoms have gone away that it all of a sudden means everything is okay. That's right. I've also heard of a thing called the window period when it comes to testing. Are you able to explain that a little bit more for us, please?
Yeah, sure. So for some people, it can take up to 3 months since their exposure to HIV for it to actually show up in a HIV blood test. So that's what they call the window period. Thankfully, as testing has improved, it is able to be picked up earlier, but that's not for everybody. So they still have 3 months as a bit of the window period. So what that means is if I was exposed to HIV today, I might have to wait 3 months until the blood test would actually confirm that as a positive test. That 3 months can be, quite an anxiety sort of time for that person. But I think as we know more about treatment and the improvements within treatment, things are a little different to what they were 10 years ago, and we'll jump into that soon. But yeah, the window period, it's always important to sort of remember that. If you're a person and you've gone to a sexual health clinic or a doctor, and they ask you, when was the last time you had, unprotected sex, for example, or when was the last time you shared a needle with somebody? You really wouldn't get a result probably until that 3-month period, but it can come up earlier. So basically the rule is to get it tested as soon as possible. And if you need a follow-up one later on, then your nurse or your doctor will talk to you about that based on timings. Yeah.
Excellent. And you mentioned before some of those signs and symptoms and being very flu-like. Is that what's sometimes referred to as seroconversion, when you're actually converting from being HIV negative to positive?
Yeah, that's the correct term used. So seroconversion is basically your body's reaction. Because it's a virus, your body is reacting to that virus, and that is what is the seroconversion. Yeah.
And trying to fight off that infection.
Positive.
Yeah, interesting. And upon registration, our participants today had the chance to ask a question, and we did have a few come in, which I'll allude to throughout our session this afternoon. And one of our participant questions was, how frequently should someone who's considered high risk be tested, and who would you consider high risk? Can you talk us through that?
Yeah, that's a really good question. So we say to people, if you're, for men who have sex with men, we say to them, if you're sexually active, get tested 4 times every 12 months. So that's pretty much, once every 3 months, which kind of also covers the window period. Of course, if you're more sexually active than that, you can have more tests. It's up to the individual to really work out, how much is more sex than normal for them. There's no sort of real guide on, if you've had this many partners, then you need to see, get tested this many times, because it could just take one person to transmit HIV. If you don't know the HIV status of the person you're having sex with, that's sort of when the risk is really there. And if you're not using enough prevention methods to keep you protected, that's sort of the riskiest time, is if you're having sex with someone who doesn't know their HIV status. And in a lot of our work, we really target people who don't know their status because they've never had a test before, because generally they're the ones who are most at risk of getting, ill, but also they're the ones who are more at risk of transmitting that to someone else. So they're our target, people who haven't had a test before in the men who have sex with men population. Of course, it's really important for everyone else to sort of consider it. I've got a few things noted down here. So if you're someone who has multiple partners, or you've had a recent partner change, that might be a good time to get a HIV test. If you've been diagnosed with any other STI, or if someone has contacted you and said they've got something, it's best for you to get a HIV test as well as get tested for whatever they've contacted you for. So people who use PrEP to prevent HIV, they need to get a test every 3 months, and I'll touch on that a bit later. Someone who's had a sexual contact with someone who is at risk of HIV, they should get a test, a regular test. Migrants from countries with high rates of HIV, they should get a HIV test as soon as they can. Pregnant women, of course, and anyone with the symptoms that I mentioned before. So, yeah, if you feel like something's not right and your doctor has done other tests, it might be a good idea to have a HIV test as well, just in case.
Yeah, and I think that's so important, particularly with women, because women are often overlooked when it comes to HIV screening by the GPs, and they may be having some of those signs or symptoms, and it's not even at the front of the GP's mind that they could actually be at risk of HIV because they haven't asked appropriate questions. So I think a few of the key take-home messages for me there is, if more sexually active or potentially at risk, it's a great idea to have a HIV test, and that annual testing at a very minimum is always a good idea for HIV and other STIs. And are you able just to speak a little bit about why being diagnosed with another STI becomes a greater risk for HIV? What happens there?
Yeah, sure. So if someone has another STI, it could potentially form an entry point for HIV to enter the body. So if they've got a sore or something, and there's some blood to blood contact with that sore, that's an entry point. So yeah, that's of course not for all STIs. As we know, some STIs show no symptoms at all. But yeah, it is more at risk if you've already got another STI. So hence why if you've been contacted or if you have symptoms of another STI, it's good to get a HIV test at the same time.
As well. And generally, would people be offered a HIV test at the same time as a regular STI test, or it really depends on the sexual questioning around partners and risk factors?
Yeah, that's a really good question. So a lot of the time, people will have to say they will need a HIV test. Not all physicians will automatically include it, especially with women. And as you mentioned before, it's a population group that often gets overlooked, just because, a woman has a male partner doesn't mean she's not at risk. He might have other partners that, she doesn't know. And if she's getting a STI test, it should cover the whole spectrum. So unfortunately, people often have to say, oh, I need a HIV test as well. For me personally, if I've had a new doctor, I've had to actually tell them, oh, I have sex with men, so I'll need a HIV test when I get sexual health screening. That's mainly if I haven't gone to like a queer friendly doctor who is a bit more open and inclusive and has provided me that space to disclose that information. So there's, it can be tricky, especially in regional areas. If someone has had, the same doctor for their whole life, and it's the family doctor, and perhaps that person is a man who has sex with men and has a female partner, it might be really confronting to talk to their doctor and say, oh, I actually need a HIV test because I've been sleeping with men. So yeah, we really try and have a lot of education about that for GPs, so that it's not a judgment sort of situation, because we want people to be able to actually ask if they need a HIV test without fear of, stigma.
Absolutely, and it's that stigma and discrimination that I think has kept it, where it is, because we're making assumptions about who we think may be at risk of HIV and who we should and shouldn't be testing. And I think a really good example of that is the fact that HIV is part of the antenatal screening in New South Wales for pregnant women. So unfortunately for some of those women, they haven't known of those risks or known their status until it's come to their antenatal care, and then that's when it's shown up. And I think the other important thing just to touch on in regards to testing, it has to be informed and consensual, doesn't it, to be tested for HIV? So you can't just be tested for it without knowing. Is that right?
Yeah, correct. You either ask for it and it's ordered, or the physician talks to you about it and says, I think we should get a HIV test, and
Mm.
you will have to give consent for that. Yeah.
Yeah. And is it true now that that can just be verbal consent? Because I think in the past it was like a signature, wasn't it? Like an informed consent checklist.
Yeah, so I mean, every time I've had a test, unless it's at a community testing centre, like if it's with a doctor, I've always signed.
Signed.
I think, and even when I've been at the pathology, I've always signed the document to state this is what I'm getting tested for. And yes, that's correct.
And it's so important because I think, not so much in recent times, but in the past, people didn't even realize that they were being tested for HIV. And then, boom, you're being told that you have HIV and you're like, oh, I didn't even know that I was being tested for that. And that can obviously have a really big impact on how that person accepts that diagnosis as well, and what that means for them from that the cognitive psychosocial point of view as well. So
Yeah.
really
And
important
if someone
consideration.
is getting tested, and the nurse or doctor is quite well educated about HIV, they will talk to them about the window period as well,
Yeah.
and really make sure that, look, we might get a HIV negative test now, but I'll still need to test you in so many months' time just to cover that window period that can happen.
Yeah, excellent. Thanks, Joseph. And just for anyone who is online with us this afternoon, if you didn't have a question when you registered, but you have a question now, please don't hesitate to drop it in that chat box and we will get to it as well. And I think you will touch on it. I'm going to hold that question over actually, because I know that we're going to touch on it in just a moment. So now that we know what it is, we know some of those signs or symptoms, and we know and have a bit more understanding around the importance of testing and when we should be going and getting that testing done, how do we actually prevent it in the first place? Is HIV preventable? How do we prevent it from happening?
Yeah, there's quite a few ways now, which is really good. So back in the 80s when HIV started, no one really knew how it was transmitted. In the really early days, people were isolated because they didn't know whether it was airborne or not. And unfortunately, that was a really sad time for those patients because often they were left alone and no one could enter the room, and it was really quite traumatic. Thankfully, when the science caught up and worked out that it was a blood-borne virus, they knew that physical barriers such as condoms, male and female condoms would work. So condoms have been around for quite a while. They're widely accessible, they're pretty cheap, they're effective, and they're easy to use. They've been around for ages and have been used quite well, especially within the men who have sex with men community. But thankfully we have PrEP now, which stands for pre-exposure prophylaxis. And that's a course of antiretroviral medication, which is taken at specific intervals, and that prevents the HIV virus from being able to replicate within the body, which is really good. So PrEP can be taken daily, and that's for anyone at risk of HIV, or it can be taken on demand, and that's for cisgender men only. So trans people can't do the on-demand version of PrEP. So on-demand just means if I know when I'm going to have sex, I can sort of take a bit before and some after to cover me for that period. I won't go right into the dosing methods because it is a little confusing. So it's really important for those people to have a lot of alarms on their phone to tell them when to take their PrEP pill. PrEP can be prescribed by a GP or a sexual health clinic, and it's obtained via a pharmacy within Australia, or it can also be ordered online. So that's a new prevention method that has only really been around for the last sort of 6 years. New South Wales was really integral in the trial of PrEP, and that was called the EPIC study. And we were actually a global leader on that. So big pat on the back to New South Wales for that. Another prevention method is treatment as prevention. So what that means is a HIV positive person is on treatment, and the treatment has suppressed the virus so much that their level of virus is undetectable in a blood test.
Mm-hmm.
And when that person hits an undetectable viral load, they can't transmit it to anybody else. It's impossible. So that has given a lot of freedoms back to people living with HIV, knowing that if I'm on my treatment, I can't give it to anybody else. And, you know, if everyone could just think of what that would feel to them. I think we can sort of go, all right, well, when we get an immunization and we go, okay, I'm not going to give something to somebody because I've been immunized for it. It works similar, but the treatments that people living with HIV take can be varied. Some take just one tablet a day, some need to take multiple tablets a day. Yeah. And it all depends on how their body reacts, because there's quite a few different antiretroviral medications available. So some have a bit of a cocktail, some just need one, and they work all of that out with their doctor. But yeah, it's very exciting news that an undetectable viral load means it can't be transmitted to anybody. So that helps reduce new diagnoses. And finally, the very last prevention method is more of an emergency prevention method, and that is called PEP, and that stands for post-exposure prophylaxis. So that is a course of antiretroviral medication, very similar to PrEP, and it's taken over 4 weeks. However, the person needs to start it within 72 hours of their HIV exposure. So it's that 72 hours is really important. If it's started after it won't work, and they're more likely to seroconvert. So it's an emergency use only. It's not to be used as a regular prevention method, and it can be accessed through emergency departments at hospital and some pharmacies, but that's mainly in the sort of pharmacies within cities, not so much in regional areas.
Yeah, and I think a lot of healthcare workers have accessed PEP if, potentially they've had a needle stick injury or something like that, and that they have concern. We've got a couple of great questions coming in actually, Joseph, which I might just allude to now. So why you mentioned that trans people, only cisgendered people can take the PrEP on demand, and trans people can't. Are you able to explain why they're not able to use that on-demand method?
Yeah, so it comes down to how hormones are working within the person's body. The daily method at this stage is the only method advised for trans people. They're still doing more studies on other methods, but at the moment it's just daily tablets for trans people.
Great. And I know that the treatment as prevention, as you mentioned, it was such a turning point. I remember I was in the counselling role at Sexual Health Clinic when that sort of started to come on board, because for quite a long period of time, someone might have HIV and it wasn't until their viral load got to a certain level that they would actually begin treatment. But now that everyone's offered treatment once they're diagnosed, I do believe that's been one of the biggest contributing factors. And like you say, HIV positive people really taking that responsibility and protecting not only themselves, but then also the community and those around them. So yeah, again, hats off to our HIV warriors and the steps that they've taken for us as a community as a whole. What about cost, Joseph? Like PrEP, taking something every day, is it expensive? Is it subsidized?
Yeah, so PrEP is on the pharmaceutical benefits scheme, and one sort of course, which should last you 3 months, costs about $40.
Okay.
Yeah, so it's a little bit more than $40. It's gone up to, I think, 42-ish last time I bought mine. I'm trying to remember. So yeah, it's not a huge cost, and that's where the on-demand method for cisgender guys, it might be a bit more cost effective. Like if you know you're not going to have a lot of sex, then you can do the on-demand session, say like when you're going on a holiday or if it's Mardi Gras season. But yeah, a lot of people stick to the daily mainly because it's easier for them to remember, and they can afford the cost. There are some programs about to help people if affordability is an issue, or if they're Medicare ineligible. So of course, if you don't have a Medicare card, you don't have access to the pharmaceutical benefits scheme, subsidized medication. So there are some programs out there available for those people who might find it a bit of a struggle, because of course we want it to be accessed by everybody, not just those who can afford it. So that's with PrEP. With treatment, if you are living with HIV, it is free for those who are eligible. It's not a cost. But once again, for those who aren't eligible, there are programs available, such as Positive Life New South Wales, I think, has a program.
Yeah, I think Bobby Goldsmith does too, in terms of paying for medications and treatments.
That's right. And ACON, of course, would also assist people where possible, or refer them on to ways that they could get treatment that won't be at a cost. Because if someone's on treatment and they're under take-or viral load, they can't give it to anybody. And that's what we want, where we want to stop transmission. Yeah, it'd make no sense if we went, oh, sorry, you can't afford it, too bad, you know.
Yeah. That cost benefit analysis, isn't it? Like the cost of prevention is better spent than the cost of treatment.
And we're in a rich country that we're able to do these things, and we have organisations that have funding to help out people when they need it, which is really good. How
fortunate we are. And it's probably, I know that you're probably going to bring it up a bit later, but it is again a point of highlighting that World AIDS Day is coming up on the 1st of December, and that's the reason why those organisations are fundraising around that day, and that a lot of that money does go to not only looking at research in terms of treatment and vaccinations and cures, hopefully one day, but also to pay for that treatment and to support HIV positive people in the meantime. So like you say, how fortunate we are to live in such a rich country where we're able to support people in that way, because we certainly know that's not the same story. Even in some developed countries, like the US, for example, the cost of treatment is just phenomenal without that social support behind it. So
yes.
All right, shall we move on to talk about the treatments, a little bit more around prevention, vaccines? Have we learned anything from COVID? Has COVID learned anything from us around HIV? What's happening?
Yeah, so quite a bit of, HIV vaccine research helped the COVID vaccine research.
Is that how they developed it so quickly?
So, I mean, it certainly helped. And now it's sort of also coming back the other way. So I don't have all the exact information to share with you, but if you had a look online, you would be able to find it. But there are some of the COVID vaccines that have been developed, which are now the pharmaceutical companies who made that are going, okay, maybe we can take this process over to HIV vaccine. I think Moderna is the one that comes into mind. I think they're the one who are looking at going, okay, maybe we can do this for a HIV vaccine, which would be really good news. So yeah, as you mentioned before, currently we don't have a cure or a vaccine, but we are looking, there is research being done on long acting PrEP. So that might be an injection, or it might be a little device that gets put on your arm and it injects some PrEP every now and then. So there's a few of those sort of things that are in development. And an implant as well, like one that actually goes into the body. And I think that's meant to last a year. So there's a few new things coming out, and that can also be replicated for treatment. So for people who are living with HIV, because not everyone is able to swallow a tablet. Some people don't have that ability. So to have other methods that fit them is more accessible for everybody who needs that. So that's very exciting news. I personally would prefer to get a long-lasting injection rather than having to take tablets all the time for my PrEP. It would just be so much easier. You'd sort of get your test done when your test comes back, because with PrEP you do have to be negative to take PrEP. So that's why you get a test done before each time you need to get prescribed PrEP. And
so that's the 3 monthly testing that you were alluding to earlier.
That's right. Yeah.
Right. Yep.
So yeah, it'd just be a lot easier, I think. And you could get it all probably done at the sexual health clinic or the doctor. No need to sort of go to the pharmacy even, which would be really good. So fingers crossed they come out. Obviously, we would love a vaccine or a cure, but if those aren't possible, then long-acting treatment and prevention would be really, really good. I just think the more options you give people, the more likely someone is going to choose one and be on it.
Absolutely right. And to me, the comparison is contraception. Yeah. Like, we started off with just having the oral contraceptive pill, but now we have things like Implanon that can last up to 3 years. And we know more about Mirenas and intrauterine devices. So it sounds very similar in terms of we need to keep moving and changing with the times. And like you say, making more options available for people. And then that leads to increased compliance. Increased compliance leads to decreased viral load and decreased transmission. So it makes so much sense, like you say, that they're continuing to listen to the community and think about what it is that the community is actually asking for and needing as well. And it's no word of a lie that some of those HIV medications are literally like horse pills, people. They're massive. And as somebody who very much struggles to take tablets myself, I definitely couldn't take multiple HIV tablets a day. So I can totally understand why those long-lasting injectables are desirable to many people out there.
Yeah, definitely.
Just in terms of like those testing rates, Joseph, in the prevention, like we know that general testing rates have obviously continued to increase or remain fairly stable in New South Wales. And I think that testing is really important in terms of finding those numbers too. But you just have some information that you'd provided us here in terms of the percentage of MSN living in living in New South Wales that potentially have undiagnosed HIV. How do they come up with that modelling and that number? And what is that number?
We estimated at about 8 to 11% are living with HIV and they're undiagnosed. And that number has come from a few different research sort of programs that have happened where they've recruited men who have sex with men who have never had a HIV test. And through that data, that's how that number has come about. It's a tough one to sort of figure out, because if they haven't had a test, how do you know?
And I think, is it true though that, historically that some people didn't want to test because they'd just rather not know, but also because of that having to notify your sexual partners of your HIV status? Has that changed a little bit now that PrEP's come on board? Like, is there still a responsibility to notify your sexual partners of your HIV status? Is it still like a legal thing?
No, so legally you don't have to disclose your status because everything has sort of come back to the individual. So, for example, it's up to me to, protect myself. Yeah, it's not up to anyone else. So I have to, take the measures for myself to protect myself from anything. It's not up to the other person. Having said that, though, if someone is living with HIV and they're not on treatment and they're willingly trying to spread the virus, that's a different story. That is not a very common thing. No one wants to do that. it's just not something that people want to do. There's also sometimes a bit of the stigma that people living with HIV must be very promiscuous, or live riskily. That's not correct either. As I said before, it could just take one time. If I was having sex with a person for the first time, that could have been the time that I got HIV. So just if someone ever discloses to you, don't ever think, oh, they must have slept with everybody. That's not true. But yeah, with disclosure, if someone is living with HIV, most people will disclose their status just to be open and upfront about it. And most who do that are, very comfortable about it and educated about it. And that's an individual thing, not everyone likes to disclose about their status, and nor should they have to. If they're taking the treatment and they're undetectable and they know they can't give it to anybody else, then they don't really need to disclose that information. In some sort of work contexts, people do need to disclose their status, and that's just to do with the nature of the job that they might be doing, and it might be a medical sort of thing. But generally, people don't need to know because it's not relevant. And if you're getting asked about your HIV status, and it's not relevant to the thing that you're filling in or being questioned about, then I would be a little suspicious of why they need that information.
Yeah, and even disclosing in the workplace and things like that now, it's we don't have to, unless it's
no.
Like there's only a couple of situations, like you said, if you're defense,
very specific,
things like that.
But there'll be a link that you'll get sent to, and it's the one of the legal centres, and it's got a really good page about the legality about HIV disclosure. So if you want more information on that, you'll get the link after today.
Excellent. And is it true also that even with, because I'm so in touch with dating online, but those online dating now, quite often you'll see somebody's PrEP status, like if they're taking PrEP or not, that they're including that information in their online profiles. Is that right?
Yeah, so a lot of the apps will have a spot to put your status if you want to disclose your status. And they also have a spot on like what prevention methods you use. So sometimes, you might see guys who go, oh, I just use condoms only. Others might have a combination of them. So condoms, PrEP, undetectable viral load. And we're all for the combination approach. If someone is taking PrEP and they want to use condoms as well, great, because that might help you reduce your risk of getting other STIs as well. So that's really good.
Yeah, it was I think PrEP was a little bit of a double-edged sword, wasn't it? Because the MSM community for such a long time had done such a wonderful job with condom use, and those messages were, condoms prevent STIs, prevent HIV, and then all of a sudden this essential wonder drug PrEP comes out and everyone's like, the condoms are over, like never again do we have to shower with a raincoat on. And so PrEP's being taken, condoms have gone by the wayside, and then all of a sudden we see increases in gonorrhea, chlamydia, syphilis, and we're like, oh, maybe we should keep the condoms in the equation for a little bit longer yet. And like you said, the reason why that is a concern is because the presence of some of those STIs are going to increase their chances of contracting HIV. So then it makes the use of PrEP, it's like, oh, what do I do? Keep using condoms, people.
Yeah, thankfully, if they're on PrEP, then they're not going to get HIV, even if they've got one of those other STIs. So they're covered for HIV. A lot of times in my work, I might have a community member say, oh, I don't want to go on PrEP because I don't want to get other STIs. And I'll ask them, okay, well, do you perform oral sex without a condom on that person's penis? And they'll say yes. And I'll say, okay, well, you're at risk of other STIs anyway, just for doing that. And there's also evidence to suggest that some STIs can be transmitted through heavy pashing. as well. So I kind of feel like, if it's going to happen, it's going to happen with, gonorrhea and chlamydia. And it's just really being aware of changes if you get any symptoms, but also just to have those regular tests. That's the message. Just get regular tested and you'll be fine. And I know there's a lot of new developments happening within the other STI spaces about, long-acting sort of prevention, antibiotics and that kind of stuff. But that's not what we're here talking about today. That might be a future one.
That's STIs 101 again next year, maybe. Yeah. Thanks, Joseph. Such insightful information. And I guess there could be some people out there today who, either for themselves or family members or friends or clients that they're working with, they may just have started their sexual journeys and really working through their sexuality and identity and stuff. Where would somebody start their journey when it comes to PrEP? Like, how would you know it's a good idea for you to start taking that?
Yeah, well, there's a lot of good websites, and you'll get all of the links sent to you via email. So we've got a lot of information, of course. The New South Wales Health website has a lot of information. Caddyshack also has a lot of information. There's a website called PrEP Access Now, which talks to you a lot about PrEP and where you can get it and how to get it. It also has, I think it has like a letter you can print off. So if you're a bit unsure about talking to your doctor, you can print off this letter and give it to your doctor, and it just saves you having had that conversation.
So good.
Yeah, so there's a lot of resources out there. When it comes to HIV prevention, it's really up to the individual. So we very much don't go, everyone's got to go on PrEP, or everyone has to still use condoms. We're very much like, you got to do what's best for you, because that provides the best results. In a lot of things, especially within health, if people are, said, oh, this is your only option, and if it doesn't work for them, it might not actually work for them, because they'll either stop doing it or they'll just go, oh, it's too hard, and just throw it away. So we're very much like, you choose, learn about everything, be informed, because I think informed choice within health is super important. It gives that person autonomy over their decisions and what they want to do, and power within that. So we talk about all of the methods and say, look, you do what's best for you.
Great words, Joseph. I think you've hit the nail on the head there, that informed choice. Like, how important is that across all areas of healthcare? And thanks for highlighting that for us. I think it's a really important term for us all to remember when we're out there working with our clients. So we're sort of starting to draw to a little bit of a close. How is it that ACON as a service is supporting people with HIV?
Yeah, so we have not during COVID times, of course, but we would have camps for newly diagnosed people, and that's predominantly men who have sex with men, and they would go away on this retreat with other newly diagnosed people, and it just is a chance for them to bond and have a conversation about it and how they're feeling. And that's led by peers, so people who are living with HIV, and they talk about their experiences and all of that, which is really good. We do, of course, provide a lot of resources to community groups and services. So we've got a lot of information that we can post out to people. We provide condoms to venues, community groups, things like that. We provide meals within our offices. So that's in Sydney and in Lismore and the Hunter. During COVID, of course, all of that had to stop, and we did a lot of food delivery within Sydney. Regionally, I work with other organisations within the regions about just sharing the information and making sure people are educated about it, so that if a service is looking after somebody and that person wants to talk to a HIV counsellor, then that service knows to contact us, because we have a counselling team for that, and that person can chat to a counsellor about their new diagnosis. So yeah, there's a lot of different stuff that we run throughout the year.
Excellent. And I guess this helps us to give ACON a little bit of support, but also to raise awareness about World AIDS Day and what's happening for you guys in the lead up to World AIDS Day on the 1st of December.
Yeah, so 1st of December is always World AIDS Day. And there's quite a few events happening around, obviously not as much as what there has been in the past due to COVID. I think because, a lot of entertainers and services and organisations, we weren't really sure of
what was going to be happening
this year was going to look like.
Yeah.
So it's a bit of a World AIDS Day light, but we do have the Red Ribbon Appeal website, which people can go onto, and they can buy a virtual red ribbon and put it on our virtual wall. So you'll get the link sent to you in the email. So if you'd like to donate, you can do it that way. You can also buy merchandise. So you can't really see it well, but I've got a t-shirt on. So we have shirts and bandanas that also act as a face mask, by the way. So that's, very on trend at the moment. Ribbons and things. And if anyone wants to buy a pack, they can buy a pack and sell it within their workplace, or if they want to hold like a little bake off and everyone sort of chips in a bit of money to buy some of the cakes at work, then yeah, you can always do that. There's a lot of really good options.
Awesome. And a bit of a shameless self-promotion plug here, and Jen has just put it in the chat to everyone. We have our beautiful surfboard by Lauren Henry down here in the Illawarra Haven area, and it will be drawn on World AIDS Day. So your last chance is to get entries into that beautiful surfboard over the next couple of weeks. So Jen has put down there how to access that via our webpage as well. So just as we are nearly drawing to a close, just a reminder, if anyone has any questions, please don't hesitate to pop them into the chat box so that we can get Joseph to address them. So I guess just rounding off, Joseph, like you've already touched on quite a number of resources and some fantastic web pages and places that people can be going for further information. What are your sort of top recommendations in terms of resources and where people can go to for more?
Yeah, well, definitely our Ending HIV website. That's got a lot of really good information around HIV, of course, but also other STIs. It is predominantly focused towards men who have sex with men, but it's a really good website with lots of information. PrEP Access Now, if you want really specific information about PrEP and where to get it and any resources to help people, that would be a really good one. And of course, anything that Caddyshack does, because you covered it all as well. And that the way that Caddyshack, is run is for everybody. So I think that is really good, especially for people who don't identify as a man who has sex with men. Sometimes, we all need those resources that cater to a broader audience, not just a specific audience. Both are important. We need those specific websites like Ending HIV to really target certain populations, and because men who have sex with men are generally, it depends on each year, but it's generally 70 to 80% of new diagnoses each year. So that's why it's really important to have a specific website for them, because it's the bulk of the new diagnoses, but also it needs to be in the language that they use and understand. Yeah.
Absolutely. And we didn't even pay him for that plug, people. That's just a nice little plug that he throws our way. I did tell you he was one of our biggest fans, as are we his. So just in terms of condoms, for those of you who don't know, services can be accessing 144 free condoms through PlaySafe Pro. That link will come out in the follow-up email as well. And we haven't really touched on it, Joseph, but just in terms of home testing and like dry blood spot testing, have you got anything to say on that at all?
Yeah, so on our Ending HIV website, people can book a U test, and that is one of our peer workers at our ATES clinic on Oxford Street would get in contact with that person and have a bit of a chat with them, and then they would post out very discreetly in discreet mail packaging a test that they can do at home. So there's two options. There's the dry blood spot test, which people prick their finger and they put 5 drops of blood on a special card that is in the kit, and then they put it all into the self-addressed envelope and they post it back, and then they'll get contacted about the result. If that is a positive result, they will be contacted by phone from a peer worker to talk to them about that and provide them referrals to counselling if that person needs it, or somewhere where they can go and give them information on how to get treatment. If it's a negative result, it's generally just a text message to say, oh, your result came back negative. Then there's the ATOMO test, which is a different kit where you still prick your finger and you put the drop of blood into this machine, and it will indicate on its little reader whether you have tested positive or negative. And what that is doing is really trying to find the antibodies within the blood drop. You still need a proper blood test to confirm it. But it's pretty accurate, the ATOMO test. And I know that they'll be available in pharmacies soon for purchase. So people in the future will just be able to go to the pharmacy and just buy one over the counter and do a test at home. So yeah, it's important to know they will still need a blood test to confirm that, but you know, it would help sort of alleviate some anxiety for some people.
Again, it's just great that there's those options out there, because I'm automatically thinking about, you know, a man may be in a heterosexual relationship but having other sex with other men, and being in a small rural or regional town where they don't feel that they can discuss this openly with their GP, but being able to access a home test really anonymously, discreetly, like it's just not anonymously, obviously, because they need to be able to get back in touch with you, but in a really discreet and confidential way is just so good. If anyone's got any questions, please drop them into the chat box for us. We are about to wrap up otherwise. So I would just like to take this chance to thank Josef for joining the Caddyshack team this afternoon. As always, your commitment to this cause and your wealth of knowledge and information is just so insightful and so inspiring. So thank you so much for joining us for HIV 101 this afternoon. And just, gratitude and thanks as always to our HIV warriors who are out there. They've done the hard yards and they will continue to do them, and there's just so much that we have learned and will continue to learn from them, and just for everyone to take some time out on the 1st of December to remember those HIV warriors that I refer to, and just to pay some respect and remembrance of the community at large. I think it's really important for us, particularly in this line of work. So last chance for any questions. Feel free to drop them into the chat box, or if you like, you could even come off mute and speak with us in person if you like. Any final words of encouragement, Josef? Words of wisdom?
Well, just thank you so much for having me, and thank you for everyone for coming along today. And hopefully you learned something new that you didn't know before. My contact details will be also emailed to you all. So if you have any further questions that come up later, you can always get in touch with me. Or if you work for a service that, would like some interaction with ACON, you can talk to me about that as well, and we can point you in the right direction. If you're not in the South Coast, we've got other workers across the entire state. So I can forward you onto them if you're from elsewhere. But yeah, I'm the South Coast person. So if you haven't met me before or seen me before, you have now. And it'd be lovely to visit you in your service in the next year. I'm really looking forward to getting back on the road and seeing everybody and connecting. I'll do a little plug. So I'm able to come to a service and do a little bit of an in-service. So what that means is I can talk to you and your colleagues about our sexuality in gender diverse communities and how you can sort of make your service more inclusive. And we touch on HIV as well, but if you're here today, you've already covered that. So yeah, get in touch and I can do one of those in-services for you in the future. It'd be lovely to meet you and your teams.
Thanks, Joseph. So as we've alluded to, there will be a follow-up email coming out to you with a lot of links and information from today, and also just a really brief survey that we'd love you to fill out. We always like feedback at our webinars, and it does really help us to prepare for those webinars into next year as well. Lots of lovely comments coming into the chat box, Joseph. Thanks, everyone.
Yes, I can see them. Thank you.
We love bringing you these webinars and absolutely love having our guest speakers like Joseph on board. So thanks very much.
No problem.
If there's no questions, which I can't see any have come through at this stage, and no one wants to jump off mute, we're going to wrap it up there. Enjoy the rest of your Thursday afternoon. Thanks again, Joseph, and farewell from the Caddyshack team for 2021. We're busy planning for 2022 and look forward to bringing you lots of great webinars and more information then. So take care, everyone. Stay safe and enjoy the World AIDS Day celebrations on the 1st of December. Thanks for joining us.
Thank you, everybody. See you.